Hello, my name is Will Daddario. I'm currently a student in the Clinical Mental Health Master's Program at the College of William and Mary. And prior to this career path, I was a university instructor in the arts and humanities after earning my PhD in theater history. Part of the motivation for my move to the field of mental health was a decade of witnessing college-age adults suffer from anxiety and depression as they attempted to attain their bachelor's degrees. And the other part of my motivation was personal. It was a personal experience with grief that manifested in 2013 after first losing my father suddenly, and then my son, and then my stepfather, all within a 2-year period. And today, I'm speaking to you to advocate for the passage of legislation that has been recently introduced to Congress that can address both mental health issues and the deep impact of grief on citizens of our country that I know only too well. The focus of my short video here is the Health Equity Access Resource and Treatment Package, or the HEART package, introduced by Representative Tony Cardenas of California. This package contains 9 bills, each of which I believe is important for the health and well-being of our nation. Since I have a realistic perspective on the workings of government, however, I suspect that all 9 bills will not be passed into law. And as such, I'd like to advocate specifically for 2 bills in the package. The first is the COVID-19 Health Disparities Action Act, proposed originally in July 2020. And the second is the Strengthening Mental Health Supports for Black, Indigenous, and Peoples of Color Communities Act, first proposed in August 2020 by Cardenas and Texas Representative Eddie Bernice Johnson. Now, you'll surely hear a lot about the statistics that demonstrate the need for these bills to become laws. Regarding COVID-19, for example, Latinos are more than 2.6 times likely than white individuals to test positive for COVID. Latino and Black people have not only contracted the virus at higher rates, but are more likely to die than white people from the virus. Latinos compose 36.6% of the California population, but represent 46.1% of those states' COVID-19 deaths. And my point in summoning statistics like this is to draw your attention to the mental health crisis that will surely arise in the wake of these deaths as communities struggle to process the reasons why their families and friends were neglected. Also, these statistics are not local to California. They represent the state of affairs across the U.S., and the CDC supports this claim. They recently administered a nationwide web survey that had the following results. Hispanic respondents reported higher prevalence of symptoms of anxiety disorder and depressive disorder related to traumatic stress dealing with COVID-19. This also led to increased substance use, increased suicidal ideation, and the numbers were all a lot higher than the non-Hispanic white and non-Hispanic Asian respondents on the survey. I think all U.S. citizens and their representatives in Congress ought to take these statistics seriously, but more importantly, I urge you to understand the passing of these 2 pieces of legislation as a proactive move to counteract what will surely be a catastrophic increase in the palpable grief felt by people of color in this country as they continue to live and work for a country whose laws do not support them. The COVID statistics point to the grim reality that we do not currently have enough laws in place to ensure the equitable treatment of all of our citizens. And so please, consider passing these 2 bills, if not the entire HEART package. And I hope that you'll take my word for it as both a student of mental health who will be working as a counselor in the field of mental health, dealing with this mental health crisis that comes in the wake of COVID, as well as a scholar and educator in the field of the arts and humanities who's seen already too much depression and anxiety. Thank you for listening. Thank you for your service.